That's probably a day's work, for Pete's sake, for a whole year on the legislature,
please.
Something like that.
Yeah, right, you know.
So at any rate, you don't get paid to speak of. And after your taxes, you probably wind up with a couple thousand. That's it at the end of the year. Rudy is a very well-known doctor in the area, physician. What's your specialty, Rudy?
Internal medicine.
Internal medicine. And
most of my patients are geriatric or
well, again,
or senior citizens.
A lot of patients are, aren't they?
Yeah.
I mean, that's
well, I like taking care of the elderly. You know, it's fun for me.
Yeah, well, you're kind of approaching that now yourself.
Yeah.
How old are you now?
54.
54. Well, you're certainly in your final third. You're now in old age. You're a senior. Did you get your AARP card?
No, I haven't, but I...
usually somebody gets it for you.
That discount coffee at McDonald's knows that.
What a deal. We don't get it in Westfield.
Oh, you don't?
No.
Oh,
they used to get, Walmart used to give you free coffee. You went in before 11 and you sat around, gabbed, and they had quite a claque over there of people just hanging out.
Well, the one place I buy gas, if you get your donut and coffee in the morning.
Yeah, where's that?
Oh, it's right across from the Y.
Okay.
YMCA in Lakewood.
In Lakewood. And you live down there in Lakewood?
Yeah, Don's Car Wash.
Okay. You were quite involved at one point with a proposal to combine Lakewood with another.
Yeah, the voters rejected that.
They didn't like that. Well, it's just like all the schools. They're trying to combine schools. Ripley and Westfield, they turned that down. And we had Fredonia and Brockton, they turned that down. Nobody seems to want to combine legal entities. And we've got all these massive numbers of boards and everything who are all doing the same work. Like in Westfield, you have the town board, and then you have the village board, and there's only one village in the town. That's Westfield.
We would have saved money. We could have reduced the cost of local government a lot. I think it would have cut Lakewood property taxes probably by about 10%. And that was even before there was actual consolidation of government offices. I think we would have still would have had the same number of police officers, and I think through attrition we would have lost some positions. We just wouldn't have refilled them. You would have had consolidation. But the public, I think they were misled by some elected officials, and I think it was a huge opportunity lost for the community to consolidate their local governments. But that, it went in front of the voters, and we'll have to wait another few years and see whether they change their mind.
How long do you have to wait to bring it up again?
It's 4 years.
4 years.
So it was a year ago.
Maybe they'll get tired of paying the highest taxes in the nation. You know, the Chautauqua County has the highest taxes in the United States of any county.
Yeah, it's way up there, and that's one reason. It's by property value too. So our property values are low, and so that makes the taxes even higher.
Yeah, it gets worse and worse. We just got a 15% tax hike in the county if you count in additional building and add-ons and additions and so forth.
Yeah.
9 across the board, and another 6 in the other building and so forth. So we had a 15% tax hike this year. Now I'm told we're going to have even a bigger one next year. Is that possible?
Well, yeah. We have an $18 million deficit projected right now, and how we close that, it's some tough times are coming. The 2% cap that did pass,
which is a laugh. It has Joker in it, I noticed.
And the only way to raise the taxes more than 2% would be for the county legislature to pass a law authorizing that you could raise it more than 2%, and it takes 60% of the legislators or 15 votes. So for the tax rate to be raised even more than 2%, it'll take 15 legislators.
Which is a slam dunk, probably, from what I hear. And same with any legislature, any county in New York State. It's a joke. It's a laugh. There's a joker in there. You just get together, some of you, and you need only 60%, a little over half, and you can overturn the law. And that's the end of the 2%. Then it jumps to 100%.
Well,
whatever.
Well, You know, I support the 2% tax cap, I think, and I did support it. I also believe that we needed to get mandate relief, and we didn't get any significant mandate relief.
In other words, they cut back on your ability to raise taxes, but they jumped your extra costs with the mandates.
Correct, and the mandate relief that I was trying to get through this year was for the state to take over Medicaid, let us be a demonstration project. It would have saved us $3 to $4 million. We had the opportunity in 2007. It was a huge mistake made, I believe, by the county. Would have saved us $2 to $3 million a year. If we would have, given Medicaid back to the state, we would have forgo some of our sales tax, but it didn't happen. But we still had, there was a resolution. It was put up in the assembly. Kathy Young had an opportunity to put it up also in the state, but she did not pass it on. I continue to put pressure on our elected state representatives and the governor to do this mandate relief. They didn't come through. We supported the tax cap. We need to get mandate relief, and this would be, the state should take over Medicaid anyhow, it's obvious.
Well, every state in the world, there are 2 states in the United States where they pass it on to the county, half of the state. So it's outrageous.
Yeah, so this would be, and they could do it now, the session, they're going back into session in September. I think people should call Kathy Young and insist that the state take over Medicaid. Let us be a demonstration project. She forced us to keep our sales tax low, which I think is good. The sales tax staying low, it helps our local retailers. We have the biggest border with Pennsylvania. A lot of people shop in Pennsylvania.
Well, sure, they don't pay taxes on their clothing, on their building supplies, and all kinds of other fair things.
So it's important.
Toilet paper.
So it's important to keep our sales tax low for retailers, and raising sales tax just so you can have property tax low. They're both taxes. We need to lower government spending, like consolidating Lakewood and Bustide. That was lowering total government spending. We need to we have numerous layers of local governments in Chautauqua County for 135,000 people. We really need to consolidate the local governments, make the government run more efficiently, will lower the total costs. So raising this tax so that you can have a lower tax over there, it doesn't make sense. In the past, that's what we did to keep in the around 2005-06, we raised sales tax up to 8.25%, had all these revenues come in. We didn't have to consolidate any local government services. We didn't have to raise property taxes at the county level, or we could, and then as the sales tax came down, we didn't consolidate. Now we have a big hole. We have an $18 million hole. The Democrats have always called for consolidation. We've led the way on that. We've led the way on reducing the size of the legislature and consolidating services at all layers, at keeping sales tax low. We've always been in the county who led the charge to keep the property taxes low or not raise them as much. For instance, last year we tried to cut the property tax. It went up by 9%. We had motions in there to reduce that in half. We would have saved a significant part of our fund balance by doing so, but it was rejected by the majority. We'll continue to lead what we think is the right thing, to keep both sales tax and property taxes low, to consolidate local government services.
So how can you keep sales tax and property taxes low when you have an $18 million budget hole and you have no way to cut back because most of it's mandated?
Well, it's going to be hard, but we have again, I think it's important that we put pressure on the state to give us some mandate relief, something this year at least. If the governor wants to see the 2% sales tax survive, they really need to come through, at least give us some Medicaid relief.
Medicaid's creaming us, right? It's the last ditch the last resort for many people who have no health insurance at all. And up here, there are a lot of people who are who are seniors, and half the Medicaid goes to senior citizens to start with. And so when they say we're doing away with Medicaid on the federal level,
yeah, I'm not asking that Medicaid be given away. I'm just asking the state to administer it. They really could simplify.
They should cover the costs.
And they should simplify it. It has 34 different programs in New York State. There really should probably be one or two. There's huge administrative waste there. A lot of for-profit insurance companies getting in on the act who have higher administrative costs. It'd be much simpler if they just streamlined it, had one or two programs. You know, Medicare is a much more efficient way to administer a government health insurance program, 3% overhead.
Which is nothing. The average insurance companies are pretty close to 30% overhead.
Well, I don't know if they're 30%, but they're...
Well, they actually, Rudy...
They feel like they are.
They are 30% because what they do is they create funds for future use in case there's a disaster or whatever, so, which they use to buy out huge corporations and control them with their boards. They have interlocking boards. And so that by the time you're finished, you lay $1 out to healthcare, to a healthcare insurer, you get about 70% back. The rest of it is swallowed up in profits, because they do, they're profit making, and in huge salaries. The president makes $1 million or more, and the huge expenses and the funds that they set up. Okay, Rudy Mueller talking to us about it, the Chautauqua County Legislature, and we're currently talking about the mandated health care. New York State is only one of two states that I believe that has passed on the Medicaid, which is when you don't have insurance, you're very poor, you don't have insurance. Seniors in many cases are in this boat. It takes care of a lot of expenses, but New York State doesn't pay it. They're supposed to pay half of it. Federal government pays for half. New York State said, we'll just pay for a quarter. We'll take the other quarter, half of our share, and saddle the counties with it, which we're being killed out here because we're probably one of the three poorest counties in not the United States, but certainly in New York State. And we have the greatest number of seniors of any county now, they tell me, and an awful lot of people who are on social services who are very poor. And so they depend heavily on the Medicaid, and the Medicaid is becoming frightfully expensive. And of course we have, as you pointed out, the Cadillac of all Medicaid. We give everything to everybody just about.
You know, I hear that it's the Cadillac. It actually...
it's a Rolls Royce.
Well, it actually, I mean, people on Medicaid, they have better access to health care than people who have no health insurance, but I wouldn't say that they have the Cadillac. I mean, they do have excellent prescription coverage and some benefits, but the program needs to be simplified. It needs to provide basic care, and it's way too complicated. It covers a lot of things that it probably shouldn't, and it really could expand or improve coverage in other areas. So I think it needs to be simplified, so there would be administrative savings there, and it'd be enough to actually lower the cost of Medicaid overall and actually provide more basic services to the poor.
Well, the Congress, in their wisdom, faced the Medicaid problem, and they had a simple answer: just pay the doctors less. They cut everybody 10%, and now, right now, it's basically the wheels have come off because, well, to give you an example, second example, I have a friend in Long Island who's a dentist, and he says, when I have a dentist come in, somebody comes in for dental care, they don't have any money, they're on Medicaid, I take care of their filling for them or whatever's needed to relieve their pain, and I send them on their way, and I don't even bother filing the Medicaid. He says, the Medicaid gives you $10. So I said, what? He said, yeah, that's what they're paying me for the cavity I filled, and my regular charge is $65 for a minimal cavity, so it's not worth my screwing around. He says, I fill out all the forms, and I have my secretary spend an hour filling out the forms for this one little deal, the forms go in, they come back a few days later, we forgot a comma or something, and they've got to all be filled out again, and this goes on and on and on, and I'll never see the $10, so I don't even bother. I just take care, it's part of my service to humanity, is I take care of